terms of politicians, I mean, we can kind of sort of get into that next with my work with Planned Parenthood, but politicians aren't always interested in data or evidence either. And sometimes it's truly about pandering to their base. And that can be a tough pill to swallow, especially with what we do and being in public health, where we're like, hey, here's what the data shows. Here's the evidence-based information. And they're like, we don't care. And you're like, how? How do you not care?
Mhm.
So I think those things are tough.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 23. Hi, everyone. My name is Omari Richards. As you all know, I've been talking in the last two episodes, so I'm not going to do much talking today. Just be sure to follow me on Instagram if you have not yet, the PH Millennial, and be sure to stay tuned for some more great podcasts. Be sure to subscribe to this podcast if you haven't as yet. I'm really excited for this guest. She is amazing, and she's done a lot of things. I know you all are going to take a lot of value from this. I hope that everyone's doing well, staying safe, and without further ado, here's today's episode. Enjoy. Today, I'm excited to announce this guest. She completed her bachelor's degree in pre-professional studies with a focus on political science and psychology at Michigan State University in 2010. After post-graduation moved from Michigan to Colorado for law school, she did a bit of a career 180 and ended up in the health field. She has worked in various positions for organizations like Planned Parenthood, specialized women's health centers, and local hospitals. She then went on to complete her Master's of Science in Public Health at Creighton University School of Medicine in 2017. She has certifications in wilderness first response, personal training, nutrition, and as a health coach. She started a consulting business, Howell Health Consulting, to provide health education and communication in the areas of reproductive health, health policy, and nutrition. You all may know her through Instagram, where she's probably discussing the intersection of nutrition, reproductive health, and policy behind the handle of at Amanda Howell Health. We have not your average public health professional, Amanda Howell, MS, MPH. Welcome to the show, Amanda.
Hi, thanks for having me on here. I know it was a little hectic trying to figure it all out.
That is fine. I really appreciate you taking your time to be on the show. Um, so, how are you doing? How are you coping during these times?
Good. We actually moved across the country during the pandemic. So not only are we figuring out how to work from home during a pandemic, but we're also figuring out how to work from home in a 900 square foot apartment in San Francisco. So it's been a little chaotic to say the least.
Okay, fair enough. Well, I hope that you're settling in as best as possible, and I'm glad you made some time for this interview because I know a lot of people are going to enjoy this story. So, how do you identify, and then tell us a little bit about your personal background?
So I identify as Caucasian, but I'm actually, what I found out recently is more Native American than I thought I was. I knew I had some Native American background on my mother's side, and it was never enough where I felt comfortable like identifying as Native American. But I did find out that I'm Cherokee, and it's a pretty significant portion. So I think that's kind of cool. So I've been looking more into that, and then one of my parents was actually adopted. So we didn't have a lot of information on that side either. So I learned a little bit more about like some Italian and British history. And then in terms of pronouns, she, her, hers, and identify as a cis woman.
Okay, and tell us a little bit about your personal background, if we didn't cover that already.
I think we had a little Wi-Fi glitch there, but I got
Hmm.
it. Personal background. So I was born and raised in Michigan, actually near Detroit. I went to Michigan State University for undergrad, and I was pre-professional with a focus on political science and psychology. So the original idea was actually to apply to law school and then work on the policy side of things. Um, After I graduate, I moved out to Colorado with the intent of going to law school out there at CU. And when I got out there, I had an entire summer to kill. So I started as a paralegal in a law firm part-time. And then I also worked as an outdoor education instructor. And so coming from Michigan, the Midwest, we're very outdoorsy. We all probably worked as camp counselors. So it felt really natural to do that kind of part-time. So part of that experience was getting my wilderness first response certificate so that you could respond to medical emergencies that happen in the woods. I fell in love with medicine. I was like, this is where I need to be. And then simultaneously, I was like, I cannot handle lawyers and politicians and policy. It's too much. I can't handle it. So I did a little bit of a career 180, like you said, and I ended up nabbing an entry level position at a hospital and sort of started getting back into school, taking some medical and nursing prereqs. I was like, maybe I belong in the medical and nursing world. And so I got an incredible amount of experience at, local hospitals. I worked at a specialized women's clinic who was doing some really amazing stuff with transgender health at the time, which 9 years ago was fairly groundbreaking. But I quickly realized that medical professionals have no training in public health, what we know is public health now in terms of, a patient's background or what they have access to or barriers to health. And then they didn't have the proper nutrition training. They didn't, there was this gap in care where they couldn't really fill in. And that's not really their job, right? I mean, providers are meant to provide that one-on-one, you're sick, here's the treatment, and then they're kind of out the door. So I didn't feel like I belonged there either. So I started poking around at some dream jobs, and everything I looked at was like, you need an MPH. And I was like, what the heck is an MPH? I had no idea. So started digging around into public health world, absolutely loved it. I felt like this was the missing piece. So kind of again, took a step back from medical and nursing world, applied for some PhD programs, or I'm sorry, MPH programs in public health. PhD might come soon, but so applied for some of those, got in, loved it. And now I'm sort of bringing it all back together, using my social media to educate on all these topics that I have about a decade of experience in, and bringing it all together because I feel like we all sort of operate in these independent little areas and niches. And what we really need to be doing is collaborating in order for community and our patients to get the absolute best care possible.
Yeah, I love that. And there's so much in there, and I hope that we could dive into a lot of that.
I know it's all big because people see my resume and they're like, what do you actually do?
That's a good way to start a little conversation in an interview or with anyone now. So before we jump into anything, what does public health mean to you?
So public health, as opposed to medicine, is the health of the community as a whole. So people listening to your podcast know what public health is, but a lot of people before this pandemic had no idea. So with medicine and nursing, it's all one-on-one with patients. And while that work matters and it's so incredibly important, like you can only do so much on any given day face to face with one person at a time, right? So public health, especially in the area of like health education and communication, is so broad. I mean, the limit doesn't exist, especially when considering, tools like Twitter or Instagram. So we have this capacity to share important health information in a massive and impactful way. So I always try to compare it so people get that better idea of public health as the whole community and medicine nursing is one-on-one, and you need them both. They're important.
Yeah, absolutely. Thank you for sharing that. So I guess jumping back to your bachelor's in pre-professional studies at Michigan State University, why did you decide to pursue this major or this undergrad degree?
So I have a bit of a traumatic childhood story, actually. And without delving too far into the specifics, I dealt with a narcissistic and abusive parent. We were in and out of family court until I was an adult. And I was witness to a lot of shortcomings in the legal world when it came to protecting people. So as a first generation college student with that type of background, I went in and I was basically like, I need to help everybody. Like helping is what I do. It's like the stereotypical response when you ask, someone if they want to go to med school. I want to help people, but it's true. I mean, that's at the base of it. So I didn't really have anyone to guide me. So I just picked what felt like it made the most sense. And for me at that time was like a pre-professional, like a law school track. So it was basically a pre-law track and a mix of political science and psychology.
Okay, awesome. And so coming out of this, you then started your health consulting business, Amanda Howell Health. So how did that come to be? Like, what inspired you to?
So yeah, it wasn't always Amanda Howell Health. That sort of came to fruition, throughout the process. But after the first couple of jobs I had in the medical world, where I was seeing that gap in nutrition. I was like, well, shoot, this is a pretty easy thing to fix. Like, let's get a couple nutrition certifications. So when I did that, I basically started coaching clients one-on-one. So I usually work with women, in their 20s and 30s, diet and exercise. And I was doing that one-on-one. So that was able to just kind of offer me some flexibility, some income at the time as a quote, side hustle. And from there, I was able to just build on that, which we can talk about kind of later in the podcast. But um, it's just, I think it was more flexibility than anything else. Because even as I was looking at potential MPH roles, it seems to be very specialized. You'll see like, HIV specialization or like nutrition counseling. And I love about four different things and I wanted to be able to mush them together. So more than anything, it was flexibility, and it started as nutrition coaching and it's grown into what it is today.
Okay, awesome. And I'd love to dive into that a little later. But so how was this business going like before you got your MPH? Like did, were things going well, and did you feel comfortable doing all of it?
I I mean, it was always a side hustle, right? So it was like that little bit of side income. And I had a few one-on-one clients. I'd be working my day job and like on my lunch break, between patients, I'd be frantically checking in with my nutrition clients. It was just one of those things. And then throughout my MPH, I realized I could actually use this platform to do more than talk about nutrition. So what was formerly Warrior Coaching turned into Howell Health Consulting. And it's just, I think it's the evolution of any business or brand or developing what you want to do in your job. You just take it as it comes and evolve.
Yeah, absolutely. You have to start going and then let the path unfold before you as you start going. So you spoke about getting into a couple different MPH programs. Why did you choose Creighton University School of Medicine?
So a lot of them at the time, pre-pandemic, required you to be on campus. And we move a lot. We've moved from Michigan to Colorado to California. My husband's job is in tech, so he kind of has to go where his clients are. So I needed to be flexible. So I had to have a program that was online. And at the time, back in 2015, an online program was very controversial. Nobody wants to do an online program. And this one was great. It's from a reputable school. The program had what I needed and it worked out really well. I mean, I was able to actually keep my full-time job at an OBGYN while getting my master's in public health, which was great because having that income is always nice. So, I mean, it worked. And now, of course, with the pandemic, everyone's all about online learning all of a sudden. And I'm like, well, dang, I was one of those, first people through there. But my concentration was in health leadership and administration. And like I kind of touched on before, I was so reluctant to choose something really specific. I mean, I could see maternal and child health working out really well for myself. But then I was like, well, shoot, what if I want to talk about health policy or if I want to talk about nutrition? Like it just, again, leadership felt like a better fit and they had that opportunity. So it just all worked out really well, I think. I did actually get to go, because it wasn't a pandemic at the time, drive out to the graduation, walk with my class. It was a really small cohort. So it still felt really personal.
Okay, yeah, and that's awesome. That's kind of like the same thing for me going into my MPH program. I wanted to do like big picture things, so I wasn't sure what I wanted to do, and I felt like everything with social determinants of health kind of like interested me. So I chose health management and policy, and I think that leadership part that you got in your MPH is probably pretty awesome. So you just said that you were working as an OBGYN while doing your MPH, while also having the side hustle. How did you balance all of that?
I don't really know. You just kind of do it. So I got really lucky though. I was working in a private practice, and private practices are notoriously a little bit more flexible. I reported to one physician in particular, and she was one of the founders of the practice. Her schedule was very flexible. So she knew I was getting my MPH. She knew I had goals beyond doing what I was doing. And she was like, if you're not dealing with a patient or, your work is done, I don't care if you go off and do some homework or, do what you need to do. So I just got really lucky in my situation with a really flexible boss. Like I said, I'd utilize my lunch breaks to check in with clients, use my weekends. You just kind of do what you got to do at the time. I never felt burnt out. I never felt like it was too much. Again, if you can find a flexible job with a flexible boss, that changes everything, I think.
Yeah, that sounds like a great relationship and a great work-life balance, or work-life balance, I should say.
Yes. Yes.
So, did you have any big takeaways from your MPH program?
So this is actually something I made a note of because it's a little bit of a heavy hitter, but my takeaway was that academia and health policy are not exempt from personal bias. So one of my professors actually did not agree with the work I was doing at Planned Parenthood, even though my work had been approved, um, and actually tried to fail me out of my program. So I had to defend my work in front of an academic review board. And it was kind of horrible because I was sitting there with this was actually like my thesis research. I was looking at comprehensive sexual education in public schools, so not anything like too crazy, and I had this professor who obviously had some personal beliefs that were getting in the way, and I was like, is this really how it is in academia? Like, I guess I expected better, and it wasn't really met, that expectation. So then in terms of politicians, I mean, we can kind of sort of get into that next with my work with Planned Parenthood, but politicians aren't always interested in data or evidence either. And sometimes it's truly about pandering to their base. And that can be a tough pill to swallow, especially with what we do and being in public health, where we're like, hey, here's what the data shows. Here's the evidence-based information. And they're like, we don't care. And you're like, how? How do you not care?
Mm-hmm.
So I think those things are tough.
Yeah, those definitely seems like tough challenges, and I'm guess it's good that you had them early on and you were able to overcome them or fight through them to get where you are today. But I don't think anyone should have to fight those things, and it's kind of ridiculous when politicians aren't paying attention to data and what the scientists are saying, which is pretty crazy in this day and age. But we don't have to go there today.
No, I mean, everyone sees it with the pandemic. You can see it play out in real time. It's hard when you work in a science-based field and people are like, we don't care about the science. You're like, what?
Yeah, it is absolutely kind of disheartening. But anyway,
hmm
so you after your MPH, you had a role in Planned Parenthood of Michigan in government relations. How did you get this role?
So this role was actually tied to my MPH capstone. So I was in this role to collect data on the effectiveness of comprehensive sexual education in public schools. And half of my time was spent in Ann Arbor, Michigan, working with the community outreach specialist. So one of my bigger projects was actually organizing health center tours for legislators. And it was basically meant to showcase what clinics do, how they provide for their community, what other programs they have available to them, for their community members, and then why we need legislative support. So that was kind of that really good mix of health policy and public health work. And then the other half of the time was spent in Lansing, which is the capital of Michigan, working with the director of government relations. So our aim over there was to collect all the data and then operate as experts in the meetings with legislators. That's where, we tried to help pass meaningful legislation, which didn't always happen, but that was the ultimate goal.
Okay, awesome. So you worked both as a assistant to the director and then as a community outreach specialist, or at the same time. I'm not too sure. How did you work
Yes.
at the same time?
Yes.
Okay, so
It was like half and half. It was, I'd do 2 days in Ann Arbor, 2 days in Lansing, drive back and forth across the state. It's just do what you gotta do to get it done.
yeah, how do you come across that kind of I guess accommodation or to work like that?
So the organization, Planned Parenthood's flexible in these type of roles, and they needed somebody for both positions, but they only needed somebody part-time for each position. And I was like, well, I'm available full-time. Why don't I just do both and split it, which is great for them because they're only paying one person. And it was great for me because I got a little bit more experience in both areas. And it's one of those things where, we don't have kids. My husband had his tech job that he was working at. So it wasn't a huge inconvenience for me to hop in the car, get over to like Lansing one day and then Ann Arbor the next. So long term, I don't know if it would have worked out for years and years, but short term.
Okay. So were there any like major roles in that position or one of those positions that you want to talk about?
The really fun project I got to work on when I was in Lansing, working on the government relations side, is training a whole team of volunteers to then go out and also help, just out in the community, help pass legislation. So that I felt like that was actually meaningful work because we were kind of training a whole new set of people to keep doing the work we were doing. I mean, I knew I wasn't going to be there forever. We were moving again. So being able to kind of pass the torch in a way was really nice.
Okay, yeah, that sounds great. So moving on, you have quite a few certifications and licenses, including personal training, nutrition, and health coach certification from Cleveland Clinic. So what's the timeline for these, and which ones have shaped your career the most thus far?
Oh my gosh. I think my health coaching certification from Cleveland Clinic was the very first one I ever did. It's not even available anymore. I don't even think it's an option anymore, but I think I did that in like 2011. And that was right when I was sort of getting into the clinics, right? And then seeing the discrepancy between, the information provided to the patients and like what good information actually looked like. So I was like, okay, I need to do something to fill in this gap. So I got that health coaching certification. Over the years, I added a few more nutrition certifications. I added a personal training certification because personally, I'm a power lifter. I love lifting. I love getting women under barbells. So I did that. I don't even know the timeline. I don't know when I did these things, but I somehow got them done. And so I've just sort of collected these certifications over the years so that because I'm not a registered dietitian, but short of being a registered dietitian, I still wanted patients to have access to this information. So getting these nutrition certifications and being licensed in some way felt good. So um, right now I'm actually doing another nutrition certification more because I want to, not because I necessarily need to, through a super reputable school. And that one's going to be really important in terms of taking my nutrition education in the public health space to kind of the next level. So again, could I keep working without it? Sure. But since I don't have a specialization in like public health nutrition, I felt like this was a great way, short of going back to school and tacking on another certification. So it's just one of those things where I have, like I said earlier, about 3 to 4 topics I'm really passionate about, and they certainly all intersect. And I can't really choose, so I'm gonna touch on them all.
Awesome, and I don't think you should choose. You should choose all of them as you are doing. Just
Well, and people ask, how does it all come together? And I always use this example of, say you're working with somebody who's a female who is a weightlifter and using birth control, and she's interested in how birth control affects, her lean tissue gains or fat loss. And I'm like, well, I have the answer for that. All of it. Put it together. So it matters and it's important. And if you only focus on one of those pieces, you can't really give that person the full picture of what's going on.
okay, yeah, and that makes a lot of sense. And it seems like you have like a very, for most part, if someone has a niche interest in those kind of things, or you're the person to go to for that, and I think that's awesome. Um, is there any reason you chose not to become a registered dietitian?
Well, I didn't know it was a thing back in the day. It's one of the, I didn't have a lot of guidance going into college. Like I mentioned back in the beginning, I'm a first gen college student, and it was sort of like, you're going to be pre-law and that's how it's going to be. So I didn't really know. And again, I like nutrition, but it's not the only thing I love. So could I have gone to get my RD instead of an MPH? Sure. But then again, I'm locked into nutrition, right? And it's like,
Mhm.
well, I like birth control and public health. And sometimes I like the nursing field. And sometimes I want to talk about personal training. So again, having that health leadership in public health combined with these smaller certifications just felt like it was way more flexible than tying myself to an RD role.
Okay, yeah, that makes a lot of sense. And one more thing on certifications, like if someone had to ask you advice for finding like a credible certification for any of these types of I guess fields, where would you tell them to look?
So if you're interested in being full-time nutrition, get your RD. It is the most credible. I mean, having that degree is going to be the most credible. There, I still have to operate within my scope of practice and I have to refer out to RDs as needed. But short of being an RD, I highly recommend either MAC Nutrition, so MAC, and that was started by Martin McDonald, and he is a big name scientist in the nutrition space. And he started this university. And part of it was that we're seeing so much misinformation in the nutrition space and we're not seeing any consequences for the misinformation. So everybody who is licensed through him is held to a set of standards. And if he sees you promoting anything shoddy, you're done, stripped your title. So that felt really good. And I feel like that's reputable for most people. And then Precision Nutrition is the other one that's a really good start point for people who want to be in the nutrition field.
Okay, thank you. I hope people take some insights from that. So,
Well, because I know a lot of public health people too would love to focus on nutrition out in the community, right? And it's hard because in these programs we get a lot of information on how to create, campaigns, but it's like, what about the information that goes into the campaign? And that's where some additional training on nutrition would come into play.
yeah, absolutely. And it definitely helps you be able to shape and understand what the program is doing and how it is, if it is going to be effective and how it is operated in that sense too.
Yeah, absolutely.
Okay. So when in this timeline did you start your Instagram platform and what inspired you to start it?
Oh my goodness. So, God, when did Instagram come out? In like 2010 or something?
Okay.
It was a while ago. We're all showing our age, but I didn't jump on right away. I didn't really see the value. We all had Facebook at the time, so I was like, I don't need Instagram. So I think I jumped on maybe in like 2012 after it had sort of already taken off. And at the time, it was just a way to kind of relate to my nutrition clients, get in there, talk about exercise, because the OG Instagram back in the day was all about like bodybuilding and bikini competitions and posting pictures of your food. Very important. So I was on there because I was like, well, I work in the nutrition space. I need to be on here. So it's obviously grown since then. At now, my Instagram basically operates like a mini blog. All of my posts, or at least most of them, are going to be the educational swipe posts that have become so iconic to my page. They're all about topics that are relevant to my area. So, women's health, reproductive health, family planning, nutrition, exercise. It's just a really great way to connect with people. I mean, Instagram is where people are. That's where they want their content. That's where they want their information. And I was actually talking to another public health professional, and they were asking like, well, what are you going to say in an interview, for instance, if I want to go back to school, about your presence on social media? And I'm like, are you kidding? Like, this is where younger generations are getting their health information. Like, we need to be on Instagram or TikTok or Twitter or whatever it may be, because that's where the information is. And short of only giving people misinformation, I mean, we really need to be on there, unfortunately, dispelling some health myths.
Yeah, absolutely. And I really loved your platform because when I started my platform on Instagram, you were one of the first people I saw one with like an MPH on there, and I just love how raw you got with it. And then,
Yeah, we keep
yeah.
it real. We keep it real over there. And that's what's so interesting, because this is funny. We can chat about this too, is
Mhm.
a lot of people think about public health and they think about, I'm going to be a little rude to our field for a second, but like, people who don't really want to be in the public eye, sitting behind a computer at a health center, like frantically entering data into a database. I'm like, that doesn't make people want to join the public health field. So it's like, so I was like, there's no reason why I can't show that there are different types of public health professionals out there, and you can do different things with this degree and kind of blaze your own path. And that's what I think has been most rewarding with my Instagram platform, is I get so many people who message me and they're like, we didn't even know Instagram, or I'm sorry, public health was this cool. And I'm like, I know, right? Pretty freaking cool.
I love that. I love that a lot. And I'm great that you're getting that kind of feedback. So I guess this kind of goes into the next question. So you say you're not your average public health professional. What do you mean by this?
Just like what we just said. I mean, there's this idea that if you go into public health, you're going to be an epidemiologist and you are going to be behind that computer, just punching away that keyboard, entering that data. And I was like, not that there's anything wrong with being an epidemiologist. We need them right now, God knows, because of the pandemic. But there are also other opportunities if that's not your thing, So there's just sort of have that MPH title and push it to the forefront of my Instagram and be like, look at this. This is a sweet ass degree. You can do almost anything you want with a public health degree. I mean, that's the great thing about our degree, which also makes it really hard to explain. It's like you can do all the things, and people are like, what? But you can. I mean, I've sort of now moved into the health education and communication space, and I love it. I mean, the science community on Instagram is incredible. Like we talked about, people are getting their information from Instagram. So it's just, you could work for a health department and put out a campaign, but I don't know if as many people would see it as, they would on Instagram.
Yeah, absolutely. And I think that goes back to like your friend asking you a question, what would you say in an interview? I think you'd say
Yeah.
like this is the present and the future, and this is where
Yeah.
we need to be to get across the best information and shut down the information that is not the best information.
Yeah. And
Yeah.
you're seeing it in the medical community too. I mean, I have a lot of physician friends, and just because of my work in kind of both areas, and you see them and they're dancing on TikTok, and there is a lot of pushback from older generations of physicians who are like, that is not professional. You should not be on TikTok. You should not be dancing. And my friends are like, this is where teens are getting sex information. This is where they're getting information about anatomy, their bodies, whatever. We can't not be on there. I mean, it's either going to be misinformation or we're going to be on there getting the right information into their hands. So you got to go where your community is.
Yeah, absolutely. That is so public health.
Yes.
So I know your platform is focused a lot on dispelling health misinformation, and you call out people on it, on which I love. And you, as you could tell from your platform, you want to lead people to more sustainable and evidence-based approaches to health, nutrition, and fitness. Why do you think this is important?
So, oh my goodness, I was like thinking about this while you were talking to me. What you said, nutrition and fitness. Repeat the question to me again, because I feel like I just got lost in my own thoughts.
So I know your platform is focused a lot on health misinformation, and you call people, on which I love. And as you can tell from your platform, you want to lead people to more sustainable and evidence-based approaches to health, nutrition, and fitness. So why do you think this is so important?
Got it. I was like all in my mind. I was like, yeah, got this, and I lost it. So we see it all the time on Instagram every day, right? Misinformation everywhere. It's so easy to go on to social media platforms and just honestly post complete bullshit. And if you have a big enough following, people just believe you. It's crazy. It's insane. Like nobody double checks, nobody asks. So nutrition, especially when looking at females, obviously females are not the only ones targeted. There's a huge issue with, men being targeted in terms of like not being muscular enough or tall enough or whatever. But women are overwhelmingly targeted by the diet industry, and it overwhelmingly happens on social media. So if I can get in there on Instagram and be one barrier in the way between the misinformation and these women, I consider it a day's work well done. You know what I mean? Like
Mhm.
I can't, I'm not in a clinic or a hospital right now. So I can't be there face to face saying, hey, this is wrong, this is why. But I can put out, a heavy swipe post on nutrition and say, here's the correct information. Here are the resources to back it up. Here's the wrong information. Here's why it's wrong. And people want that. They do. And I mean, my Instagram platform shows that people want it. So again, it sort of ties back, right, to why it's so important for us to be
Mhm.
on these platforms. It's just we have to get in there and get the right information in our community's hands. They want it.
Yeah. So going back to one of your points saying that a lot of, I guess, health departments, they're kind of archaic in their ways in getting health communication across. Have any health departments ever reached out to you for communication advice, or what advice would you give to a health department who wants to communicate better with their communities?
They have not, but they should. They should reach out to me. But I will say that the Denver public health department, I think, does an incredible job. So I don't know who they have on their health communication team, but they utilize social media, and they do so with really easy to understand infographics. And every time I see one, I just want to cheer, because whoever is in that department doing this is amazing. And then Johns Hopkins Health. I don't know which student is running their platform, but it is incredible. I don't know if you guys have followed Johns Hopkins School Public Health Instagram, but it is hilarious. They take pop culture moments and use them to make a point about a public health, topic. And I think it's hilarious and people love it. And it's a great way, again, to connect with the right community. I've actually DM'd them a couple times. I'm like, look, I don't know who's doing this, but it's amazing. And I'm happy to work with you anytime.
That's awesome. That's awesome. I'm glad to hear that. And yeah, I definitely think that there needs to be a push for better health communication for this century, for communities that are getting the information online and not really paying attention, especially now, granted COVID, everything's online, like
Yeah.
you should be pushing hardcore on that. So
Well, and I had a friend who was still sending out like paper mailers. And I was
mm,
like, what are you doing? I was like, no, what a waste of your resources. I mean, by the time you've,
mm,
drafted that paper mailer and gone to the printer and gotten it into the boxes, you could have had like 10 Instagram posts up and reached
mm,
a much more targeted audience. And again, you have to evolve and you have to change. And I think public health is going to be virtual and it's going to be on social media. And that's where the communities are. And that's where they expect to get their information. They're not going to the mailbox to pull out a flyer.
that is absolutely true. So you also talk about dismantling barriers to health equity and drawing attention away from privilege and unrealistic health information. Can you talk a little bit about that and maybe give us a couple examples?
I love the nutrition examples for these. So we see a lot of these more privileged Instagram influencers talking about how to be healthy. And if you're a regular person, these tips are completely whack. Like it's insane. I mean, even something as simple as like you only can buy organic food. I mean, like, have they ever worked with a normal human who's living paycheck to paycheck and or on food stamps or whatever the situation might be? It's like telling somebody that they can't eat a burger and they have to buy organic apples is so misguided and so short-sighted and honestly incredibly privileged. So that's one of the things I talk about a lot on my Instagram platform is these influencers, that's not reality. That's not good advice. It's not the best advice for the general population. I mean, in terms of public health, we talk so much about barriers and social determinants of health and all of these things that play into nutrition or exercise, and it's like there's just this huge disconnect on Instagram between influencers and real people. So even doing something as simple as dismantling the idea that you can only be healthy if you eat organic, that's a big deal because there are so many ways to be healthy short of eating organic food.
Yeah, absolutely, absolutely. I like that a lot, and I feel like I don't know where that disconnect comes from. I don't know if they just don't see their privilege in that sense, and they're just putting out this information for maybe like elite other people or something like that, or if it's just not for the community, but it is out there for the general public. So I don't know what would you tell someone that is putting out that information? How would you like go about trying to get them to put out more realistic information if you would do that at all?
So I have stopped because at some point they're not willing to listen.
Hmm.
So what I do instead, and what I encourage other people who kind of want to do what I do to do, is take all of those annoying things that you see, write a list of them, like just keep a running list of every annoying thing you see on Instagram and make an educational post about it. That way you are addressing it, but not in a super aggressive call out type of way. You're addressing it and then you're giving people the real information, the good information. And that has been, I think, where I saw my Instagram completely flip and kind of take off is nobody really likes call out culture. It's kind of, you can call out bad information, but like straight going at somebody, it's really never going to work. I mean, we see this in the vaccine space, right? If you go
Hmm.
straight at somebody who's reluctant about vaccines, they're not going to change their mind. But if you say, hey, okay, I hear you, here's what's going on, here's some information on this topic presented in a different way with and you have to do it in a way that makes sense. If you throw way too much scientific jargon at somebody, you're going to lose them. Their eyes are going to glaze over. So I take those topics and I keep a list, and when I need a post, I'm like, okay, what horrible topic can I pull off this list and smash today? So that's a great way to do it. Whatever you see something that you're just like, oh, huge face palm, just create an educational post about it. It's like your little mini health campaign as a public health professional.
I love that. I love that. I'm definitely gonna get my list going so I can do some stuff like that too.
Never ending content, I'll tell you. People are like, how do you come up with content? I'm like, I don't. Instagram does it for me.
That's awesome. Okay. So knowing that your platform has grown so much, what have you learned from having this platform?
Well, we just talked about it a little bit, but that, going directly at misinformation or the person spreading misinformation doesn't usually work.
Mhm.
So if you can take that and spin it in a more positive way, in an educational way, people really like that. They do. They have responded really well to that. So I know it can get daunting to use Instagram as like a little bit of a mini blog, but I don't know if you use Canva, but Canva is an excellent, amazing tool. Makes our life really easy because none of us went to school for graphic design. We went to school for public health. So it's a really great way to create good looking content. That's another thing I tell people. Not that this is like a how to run your business podcast, but we're all running little mini businesses at this
Mhm.
point. So people don't want to look at ugly crap. They don't. It's just that simple. So your educational content still has to be somewhat aesthetically pleasing. So use Canva, create some cute swipe slides. People love the swipe slides. And then create, a caption that isn't. I think this is where we get tripped up too, is we want to throw all the science at people, all the data, all the numbers. People don't want that. They don't want all the science, all the data and numbers. They want just enough, right, to explain it. Because I've definitely seen a few science communicators that even I glaze over. I'm like, what is this person even saying? That's beyond my head. Like, I don't know
Mhm.
how you do this if you don't have a PhD. So yeah, so keep it simple. You're normally on Instagram talking to just the average person who may have, a basic bachelor's degree, not in the field of public health or nutrition. And they just want to know how to live their lives a little bit better, a little bit healthier.
Yeah, absolutely. And yeah, Canva is a huge tool. It is great. And one other thing I think you forgot to mention is humor. Your posts have a lot of humor in there.
Well, you got to keep it light, and that's what I've learned is people. I'm very outspoken normally. Like
Mhm.
if there's something on my mind, you're probably going to hear it. And I also work in a somewhat controversial space, where we talk about vaginas all day. So you kind of just gotta go with it. And people really like that. They like seeing you as a real person. And I think I've noticed that with my physician friends too, with them being on TikTok, is it makes you more relatable because in
Mhm.
the past physicians were always like this scary thing where you never questioned them. They were like elite, and
Mhm.
being in front of your audience in an authentic way, they're like, oh, this is like a normal person. And I'm like, yes, we are normal people. I promise. Like just like you, normal people. We just happen to have a little bit more experience or education on this topic, and we'd love to share it with you.
Yeah, absolutely. And I think that personable part is so needed in the health and public health field, just getting to know people and growing, I guess, that empathy and having people feel relatable to you as you just said.
Yeah.
Yeah. Is there anything else that you constantly see on Instagram that you want to talk about or from your platform?
God, I feel like we could have a whole podcast on Instagram because Instagram is stressful. But no, honestly, I do think Instagram right now is such an incredible tool. I have seen so many public health professionals jumping onto Instagram, and it makes me so happy because one, people know what public health is and what we do and that we exist. And then
Mhm.
two, people, especially our age, our generation, we're like, well, social media is where the people is at. So we're jumping on there. And then it's also enabling us to all virtually meet each other because we're not sitting in offices anymore. So I don't know how you meet other quote coworkers anymore in public health, but Instagram's giving us that platform to all connect, which is awesome.
Yeah, it absolutely is creating that little small public health community, and I'm growing very fond of them and enjoying everyone
Hmm.
there for sure. Um,
Well, and I have yet to see
mhm.
any public health professional online putting out super cringy content. Everyone I've come across is doing such a great job educating, and it makes me so happy.
Yeah, yeah, absolutely, and I like that a lot. Um, how much time do you put into your Instagram platform?
I always get asked this question. So when I first started making my swipe posts, it was a lot. I mean, getting those templates kind of set up is hard. And then of course you want to research the topic and make sure you're not spreading bad advice. You're like, okay, I can't be one of those people. So we double check, triple check, talk to our friends, make sure the information is correct. So it used to take me anywhere between like an hour to 3 hours, which is insane, right? It's like, oh my gosh. But then you think about it and you're like, well, this is like creating a campaign. So that
Mhm.
work needs to go into it. And now that I have the process ironed out, the templates ironed out, I can bust it out in maybe like half an hour, especially if it's a topic I'm super familiar with. There are still, for instance, as COVID has progressed if I do a post on COVID, I really dig in because I do not want to make an oops and send out the wrong information to my 45,000 followers. That's horrifying to me. There's nothing worse, I think, that I fear
Mm-hmm.
than putting out bad information. So those posts are going to take a lot longer. And then Reels, Instagram's little TikTok feature, I dug in my heels for a while. I was like, I will not, because I'm not a dancer. I'm not on TikTok. I don't want to dance around in front of the camera. It's not my thing. I was like, I am not doing Reels. I'm not doing it. And then, of course, the algorithm punishes you for not doing Reels. And then you're like, well, shoot, how am I going to reach my community if the algorithm's
Mm-hmm.
punishing me? So I did post 2 Reels. And it's funny because they're COVID related and uterus related. So I was like, okay, I can use this in a way without dancing to get more information across. So it's hard because as a business, you need to grow, but then you're also forced to do things like dance and you're like, oh no.
That is so true, though. We always have to like pivot, and there's always something changing, and you have to be one step ahead of it, or just try
Yeah.
to
Have
stay
you
on it.
used Reels yet?
I have not.
Oh, it's a
I
little
was
stressful.
Yeah, I was on TikTok for a while. I probably made like 5 TikToks, and was like, this takes a lot more energy than I thought.
Yes, it's like a whole video editing platform. I'm like, look, I didn't go to school for graphic design. I do that now. I didn't go to school for video editing. Now I have to do that. You really have to like learn it all. So
Yeah, yeah, absolutely. You have to be a continuing learner, just keep on learning as a public health professional.
yes, especially to keep up with where our community is getting information. I'm like, well, shoot, they're on Reels and I'm not. Damn it.
Awesome, awesome. So, where would you like to see yourself in the future?
My dream job popped up recently and I'm not qualified for it. So I would really love to be directing a Planned Parenthood affiliate or directing the operations, directing their health education department, something like that, where I can work in a space where my education is in that reproductive health family planning space, but also I am considering going back to school for my women's health nurse practitioner degree so that I can cross cover because I do miss seeing patients one on one and public health unless you're working again in like a nutrition or a patient front. Like, I mean, if you're an HIV specialist who's, counseling, you're going to see people one on one, but especially now in our digital world, we're not really seeing people one on one anymore. And I miss that. So I would love to cross cover basically, um, work in a director leadership role where I can oversee a program or a campaign or just the communication and education department. I think that'd be amazing, while also being to kind of have the opportunity to fill in other roles as needed. I think the takeaway from my entire existence is I need flexibility. There's too many things I love to do. So if I can do that little bit of balance of both, I think that'd be great. My husband's like, can you just write a book and be done already? And I'm like, I don't know what I write a book about though. Everything, like how to be a public health professional on Instagram. Like I have no idea.
Yeah, you can absolutely do that. You can absolutely do that. That's awesome.
But yeah, so right now, honestly, my shorter term goals are just to be able to reach more people. So I'm actually building out a membership site. I'd love to get it to a point where it's filled with content, educational content on, my areas, fitness, nutrition, reproductive health, and make it sort of a big educational hub for people. I mean, I think we're all a little fatigued of Facebook. So I've noticed that my community is definitely falling off Facebook. So even Facebook groups and pages where we used to have all that information as a hub just aren't doing it anymore. And sometimes Instagram is limited. I mean, you can only put so much information in a caption.
Mhm.
So I think building out more of like an online website type of hub is my next hurdle, my next battle.
Okay, awesome. Good luck. Good luck on that. And I appreciate you sharing that like you have so many interests and like you like the flexibility because I think that's something that a lot of people have and they battle with it because they want to go into this one position. But I feel
Mhm.
like you're just setting the bar high, saying you don't have to settle for one thing. You find what works for you and you find that flexibility and you go with it.
I think it's stressful sometimes though, because I think you are expected to find that one thing that you do and stay in that job forever. And I'm sort of off doing my own thing. And people are like, I didn't know you could do that. And I'm like, I don't know if you can. I'm just doing it. So come join and make it more normalize. Let's normalize this.
Awesome. Well, I'll be looking out for that membership site. So moving on to the last section of the show, the Furious Five. It's 5 questions I ask all guests. Question number one: what advice would you give to a student trying to pursue a career in public health?
So this is what I wish someone would have told me is figure out where you actually see yourself. And I don't mean like what specific role do you see yourself in? I mean, what do you want to do with this degree? So if you, just for example, want to do something like what we're doing, educating on important topics in the health and wellness space, um, look at the public health program and see, do they have a health education concentration or a communication concentration? Can you shadow someone at a health department who works in this space, like that person at Johns Hopkins who's making those amazing infographics? See if you can talk to them. So don't just get a public health degree because you see the trendy public health professionals on Instagram living their best life. It's relatively new to the space. So just think about what you want to do with it, what your ultimate end goal would be with it, make sure it's worth it, and go from there.
Okay, great advice. Number two: if you're talking to someone wanting to get into your position, what advice would you give them?
You have to have some thick skin because people are not going to understand it. So start now. That's what I tell a lot of people is there's not going to be a right time. So where you see me now has been a culmination of a decade of growing. So if you eventually say want to have some big Instagram following and an educational platform, start now. You don't need to have a public health degree to do it. Just start putting out information. Don't be giving people medical or nutrition or fitness advice, but you can put out basic foundations of public health, nutrition, fitness, and start building up your trust with the community, because you can't just blow out of your degree and be like, here I am, trust me. No, you have to have a rapport with your community. They have to already know you, trust you. So just start now.
Okay, awesome. Number three: what's something you're working on improving in your life right now?
Oh my goodness. So like I mentioned way early at the beginning of the podcast, I'm a power lifter. And when we obviously moved to a tiny little apartment with no gym access. And San Francisco is one of the most locked down places in the nation still. So we recently got access to gyms again. So I am back under the bar, just like a little newbie, trying to get myself. And it's not like I need to lose weight or anything like that. I just miss feeling strong. So back at the gym, that's a physical one. And then in terms of mental stimulation, I am doing that nutrition program, not because I need it, because I want it. I needed something to mentally stimulate me through this pandemic.
Awesome. Well, I hope that the gyms open back or they stay open and you're able to keep lifting.
I hope so too. Fingers crossed.
Number four: professionally, do you recommend anything?
I do.
Hey!
I know that when we're listening on the podcast, people can't see this, but I pulled up The Health Gap by Michael Marmot. And this is a really great book for people who don't quite understand public health or social disparities. It's a really great read. So I think everyone should have to read The Health Gap. I think that's have you read it?
Yes, and that is that's one book I tell people that they should read. So
I agree.
Yeah.
We're on the same page. It's a good book. I even told my husband, I was like, you need to read this. He's like,
that's awesome. Yeah, that's a great recommendation. So last but not least, where can people connect with you?
So right now, primarily it's going to be Instagram, Amanda Howell Health. I'm in the process, like I mentioned, of building out my website. So not quite available yet. It will be amandahowellhealth.com. The membership site will be on there. But yeah, right now it's Instagram. And then if people need to email me, it's hello@amandahowellhealth.com. Like I said, I'm sort of pulling away from Facebook. I don't think anyone really wants to be on Facebook right now. So just keep your eyes peeled for my membership website, because that's going to be exciting.
Awesome. Thank you so much. And I hope everyone does go and connect with you if they have not already. I'm going to guess that they have, but if you haven't, definitely go and connect with Amanda. Well, thank you so much for doing this interview. I really appreciate your time and your insights. And I think everyone's going to really enjoy your story.
Yeah, thank you so much. I love chatting with other public health people. It's like having an office space that we don't really have anymore.
That is absolutely true. Well, thank you so much. Well, I'm really glad that I got to have Amanda on today. I know that she is a great public health professional, not your average public health professional. And I think she's done some really great things and she's going to continue to do great things for the public health field. And I really appreciate everything that she shared today and all the insights that she gave us. I hope that everyone is doing well. Make sure to review this show if you have not as yet. Make sure to subscribe, leave a review, like, share it with a friend, your mom, dad, anyone else. I appreciate you all. Take care and see you next week. Public Health Millennial out.